Hello, guys. Hope all is well. I'm outside of my fitness center and as well as outside of my office, but I'll pull it down just a little bit so you guys can see me and put my glasses back up. So, of course, the lighting is a little better in here. So, yeah, we're just going to go right into talking about the elbow as promised. And I apologize for my delay. I actually had a really bad migraine. So imagine that. So sometimes shout out to those who get migraines or have been getting migraines for years. I only just started experiencing them this year, and they've been pretty severe. So, but as I said, we're going to get right into it. Let me set my timer. While I'm setting my timer, I am going to make some changes on the test. I will make sure it won't be so long because I think I'm still getting students being added to the course. But just for the sake of everybody who's still getting acclimated to Blackboard and still being enrolled into the course, I won't make the test as long or as difficult. I won't say as long, but I will say I won't make it as difficult. But just so you know, go over your terms. You can use your notes, but just know it is timed, okay? So orient yourself with your notes, orient yourself with some of the topics. It will be basically the entire learning module 1, your upcoming test, and I won't post that till Friday. Now, because we're still kind of going through some transitions. The due date for that test is going to be a little bit later. I'll be a little bit lenient with this first test, but just know once we go into the first test, we're going to go right into quiz 2. So just keep that in mind. All right. Lost my timer. Wait a minute. And somebody would be calling. All right. So, we're just going to go right into the elbow. That timer thing is not working. I'm just going to keep track of my time. All right. So just so you know, the elbow is 3 bones, okay? Your humerus, your ulna, and your radius. One way to determine the difference between your ulna and your radius is that your radius is your thumb side, okay? Now, don't be confused. Just because my thumb is turned on the inside, that does not mean it is medial, okay? Your radius is lateral because palm side up is anatomical position. But just know that your thumb side is your radius, okay? Now, your pinky side is your ulna. All right. So at any given point, you may forget, oh my gosh, what's the difference? Just know that in order to take a pulse, you have to take it with the radial artery, which is just below the thumb. Okay. So 3 bones. Ooh, there goes that missing nail. 3 bones in the that make up the elbow joint. Okay. Now your elbow joint is considered a hinge joint, meaning that there's only a couple of positions or only a couple of directions of movement that it can occur. All right. So just make sure you check your text found in Brightwave, and it is on page 167, figure 15.1. Remember, mostly 3 bones. Okay. I won't go into details as far as all the specifics. But if once you orient yourself with the elbow joint, or the olecranon, that way you'll get to know about the different injuries that occur. All right. So just know that there's also 2 sides that kind of make up the elbow. It's kind of a pointy prominence, kind of something that's close to the surface of the skin. You have your medial epicondyle and you have your lateral epicondyle. Those 2 terms are very important in terms of acknowledging your injuries. Okay, so you have different triangles that occur as far as landmarks that you need to do to assess any type of injury. All right, as I said, you have your lateral epicondyle and your medial epicondyle. Remember, your radius is on the lateral side and your ulna is on the medial side. All right, remember what we talked about, what lateral and medial means in reference to the body being an anatomic or anatomical position. All right, so you got a couple of muscles. Well, actually, you have a lot of muscles that help in the movement of the elbow. And just so you know, and we'll talk about this right now. So we talked about pronation and supination, right? And we talked about it just for general purposes. Oh, let's talk about it in the wrist. Okay. What I like to do is that I like to use kind of like a central reference point to understand movement. But just so you know, pronation, supination is not really the wrist. It is actually at the elbow. Okay. It just so happens that there are muscles, your wrist extensors and your flexors go into those bones in terms of movement for pronation and supination. So when you are talking to maybe your professor, maybe when you're talking to maybe another medical professional or an athletic trainer, just know that when we're referencing pronation and supination, it is at the elbow. And it just so happens to turn the wrist as well, because you have wrist extensors and you have wrist flexors. Okay. Now, in kinesiology and in anatomy, you'll find out all the names of the wrist extensors and the wrist flexors. And I'll be very transparent with you guys. Even to this day, I still have to read and review all the terms that make up the wrist flexors and extensors, because they're so intricate. There's so many. And those who might be interested in physical therapy, just as a side hustle, just putting it out there, get to know, maybe you want to get into hand therapy, and occupational therapy. Hand therapy is a popular, or is a growing trend. And now it's starting to grow in physical therapy. Why? Because we spend so much time texting and typing. So a lot of times people experience issues with their thumbs. Okay, so if you want to get into hand therapy, I just went off on a tangent, but if you want to get into hand therapy, it's very good to get to know your wrist extensors and your flexors, as well as everything that goes on in the hand. Okay, so, and that's another recorded video that I did yesterday in terms of the carpal bones. So just kind of getting to know the hand and the forearm and how it all can function. Additionally, in addition to that helps movement of the elbow, you have your tricep to the back, okay, and you have your bicep to the front, okay, or the more current term is triceps brachii and biceps brachii, okay. All right, so you have a number of joints that connect to help or aid in movement of the elbow joint. Okay, you have your ulnar collateral ligament and your radial collateral ligament. Okay, as we talked about. Okay, your radius is on the lateral side and your ulna is on the medial side. Okay, its purposes, and we'll get into the knee, similar to the knee, its purposes is to be able to support and stabilize movement within the elbow, just so your elbow won't be floating everywhere, or no, not elbow floating everywhere, but just so your muscles can move and it can be stabilized in that specific area, so function can be maintained, so you're not kind of pronating in any kind of direction. You're not supinating in any kind of direction. So that's really what those ligaments are there for. And we'll talk about injuries in a second. We're going to go right into bursitis. As I said, I heard my grandmother say it. You may have heard your grandmother say it, or you may have heard depending on where you're from, you may have heard your Mima, your Nana say it, or even your Pop say it, or even my mama has said it. Oh man, my bursitis is bothering me so bad. So with you knowing what a bursa is and knowing that itis means inflammation, okay, you can always politely ask, well, where is it occurring? That way you'll know if there's it's in my shoulder. Not saying to diagnose, but at least you kind of have a reference point of where it's occurring. Maybe you based off of your knowledge, if you know where the bursa is located, maybe you can tell them, oh yeah, well, it's a possible overuse injury. Start practicing now, okay? So like most of our bones and tendons and muscles, there's that shock absorbent pad, your bursa, that is going to be located olecranon, okay, right in your elbow, all right? And oftentimes inflammation occurs in the bursa due to pressure, okay, especially maybe your athlete is in padding that might be too tight, or maybe, your athlete might be on the off season doing a profession that applies pressure to that bursa or that elbow. Okay, so same treatment, follow the Price's method and another video that we talked about in terms of helping with bursitis, okay, or you can refer them to the doctor, just especially if movement is limited. All right, so key thing about this, you want to prevent elbow injuries, because I have not experienced an elbow injury, but from what I heard, they're excruciating. Okay, it will immobilize the whole forearm, or it restricts movement, or if anyone were to exercise with an elbow injury, from what I've been told, it is excruciating. Okay, so you want to make sure that you are guiding them correctly, and I'll give you one example. sometimes push-ups. Okay, sometimes push-ups can be incorrectly done because someone may be doing some sort of off movement in a push-up. Okay, just be mindful of that. You have some people that'll think that they are, they have what's considered, I believe it's called hyperflexibility, where they can move their elbow in all kinds of directions. Refer them to a physician, okay, just in case, because the elbow really should only do but so many movements, okay? We address it as flexion, extension, pronation, and supination, all right? So it really shouldn't be too many other movements outside of that. So you want to make sure that your athlete is practicing safe and correct biomechanics in that, okay? Make sure you help them to strengthen the muscles around the elbow. We know to do tricep extensions or any type of tricep movement, dips, anything of that nature. Same thing with your bicep. Bicep is a muscle we sometimes ignore. So any type of bicep curl, preacher curl, any type of curl will help to strengthen those muscles. Additionally, you want to help them to strengthen the wrist extensors and the flexors. You've probably seen in the gym this long bar that may have had like a small weight attached to it, and you might see people kind of curling it up. Okay, that does help with your wrist flexors and extensors, okay? So ultimately, it also helps to strengthen the muscles so your hand won't be overused. So body works together in such amazing ways. I think that's kind of cool, okay? So going forward, now, bone injuries, all right? So we want to ask that question. Can you break your elbow? Okay, you can break your elbow, but just know if you break your elbow, it could be, for the most part, it could be all three bones, okay? Because as I said, your elbow kind of sits in a pocket, okay? And it's just allowing some movement. So if you break it and you have those two bones, I'll just use, kind of that as your two bones. If you break it, you're going to break possibly all three bones. All right. So, and you can also chip it too. So, generally, key thing is you want to protect your athlete. Last thing you want to do is have them break their elbow because there's going to be numbness, there's going to be weakness, there's going to be limited range of motion. So by all means, if it is a broken elbow, they do need to go to the emergency room ASAP. Because not only we've talked about the funny bone, you've heard the funny bone before where someone hit it and you're like, oh my God. So there's a good number of nerves that are in the elbow as well as arteries. So you want to make sure you get your athlete to the emergency room as quick as possible if they complain about any issues of range of motion in their elbow, can't move it, there's numbness, there's tingling. All that fun stuff about the elbow. Okay, so we talked about growth plates or epiphyseal fractures. Make sure that if your young athlete has injured their elbow, they need to go to the emergency room quickly because, again, you don't want to prescribe or do anything that is going to stunt their growth, okay, in terms of elbow injury. All right. So we've mentioned in the other chapters what an avulsion fracture is that the bone is just pulled off. Okay. An avulsion fracture mostly happens in the medial epicondyle. Okay. Which side did we talk about was medial? Pinky side. Okay. So definitely there's going to be a deformity and definitely it's going to be painful. So make sure you get them to the physician as quickly as possible. All right. So like most bones, like most joints, you can dislocate it, all right? It is traumatic to dislocate an elbow. That means it just comes out of the hinge, okay? Comes apart, basically. It basically goes back, all right? And that's something that can be seen. So make sure that you get them to a physician as quickly as possible. And since it's so traumatic, make sure you calm them down. We talked about it the other day. We talked about calming down your athlete. All right. So you have your elbow flexor strain, same thing. Oftentimes, a lot of this can be overuse injury. All right. So if there's any rupture, that's when they need to go to a physician. All right. So sometimes we can overload our flexors. Same thing with any muscle. We can overload it and that can cause a strain. So at that point, do apply prices and do refer them to a physician. Trying to move quickly. I think I've been on here 13 minutes. All right, same thing with elbow extensors. Okay. Now what we're going to do, we're going to go into you can go over independently wrist flexors and extensors. And if you have questions, message me. But what we're going to do, we're going to talk about medial and lateral epicondylitis, okay? Basically, golfer's elbow is your medial epicondylitis, okay? Woo, such a hard term, okay? We talked about it being on the medial side. That's, as we said, that's your golfer's elbow. Oftentimes with the injuries, it might occur in like golfers. But it's not just limited to golfers. It can occur in any athletic activity. It can occur in any occupation. Now, going forward to the same thing where, let's find, I think I missed tennis elbow. No, it's the same it's the same slide. So your lateral epicondylitis is considered tennis elbow, all right? And your medial epicondylitis is golfer's elbow. It was identified as those terms because it does and it can happen in those particular professions, but mostly it can also occur as a result of overuse, all right? So oftentimes you need to measure and determine what they're doing biomechanically. This is where biomechanics and kinesiology are important here, okay? So make sure that you stay on task to understand what the body can do and the motions it should be doing in terms of the elbow. And we'll talk about knees and that type of thing as well, and hips. To help reduce inflammation, make sure you apply prices in another video on chapter 16. Make sure you review it. I did a chart. It was either 16 or 14. I may have done both, but definitely check and see. And oftentimes if it's really severe, that's when physician may prescribe what I like to call just painkillers. It just depends on the severity of the injury. Okay, we talked about it being in 3 grades. All right, and there we go. There's your grades. It might totally lost my train of thought. Okay, just need to be monitor because I'm looking at my time too. Just monitor the severity of the injury. Totally lost train of thought. And make sure that if there is any program that your athlete is involved in, you might need to make some modifications. But as I said, this is the part where you need to understand kinesiology. So important here. And I think I'm going to stop right here because I'm at 15 minutes. As I said, make sure you review your notes. Make sure that you ask me questions. Okay. Do not hesitate to ask me questions. Send me a message and I will message you back with a response. Okay. I feel pretty good. I think I'm almost migraine free. So, make sure you review all your videos. Make sure you review all your notes in preparation of your tests. Okay. Talk to you soon. Peace.